I certainly acknowledge the concerns of the general public who probably purchased a ticket thinking that there'll be a sort of seat next to them that's sort of empty, and this is a bit of a sort of unexpected, or maybe news that's just sort of suddenly come out. I do know that from a public health perspective, we're recommending the physical distancing, the 2 meters, and if that cannot be done under certain circumstances, absolutely stick to all the other measures like the hand hygiene and wearing a mask. Wearing a mask is actually required by Transport Canada. And as you said, I think the international transportation community is looking at many layers of measures. But I do think that Canadians need to make some careful decisions, knowing what the airlines are offering to protect themselves and their families. I think individually, before traveling anywhere, you sort of need to take into account your own personal health conditions, and all the way through the really the travel experience. There are different routes from the time you leave your house, maybe to get a bus to get to the airport, etc., or along the way. I think looking at how one can protect ourselves and reduce the risk, I think, is really important. But certainly from a public health perspective, we believe that physical distancing is an important part of the measure. And if where it's not possible, wearing a medical mask and all the other measures would reduce spread.
Thank you. Next question, CTV News.
Hi, doctors. Mackenzie Gray from CTV. Following up on Ashley's question about planes, do you think it's right that the airlines are making the middle seat now sold? Up until this point, people have been skittish to fly, and it's been your recommendation that they shouldn't be traveling unless they absolutely have to. I think this would make it a little more difficult. And for both of you doctors, would you feel comfortable being on a plane right now in the middle seat with the aisle full?
So, yeah, I think there are some sort of difficult decisions and for travelers for sure. And I think making sure that we all, as I say, understand our own individual risks for COVID-19. We in public health, together with the chief medical officers, recommend some very careful thinking before you travel. We're still recommending right now avoid non-essential travel to other countries. Within Canada, medical officers are recommending, in general, stay closer to home and, travel. If you're going to have a vacation, make sure you do that in a safer way as possible, which includes staying closer to home. But I do recognize that, provinces, for example, having managed the cases, opening bubbles where they're trying to increase the safety of those transportation and experiences. But again, as I said, from a public health perspective, keeping the physical distance is important. And if for whatever reason that is not possible, wearing the non-medical masks. I think airlines, where it is possible for spacing to occur, try really hard to do that. And maybe for certain individuals, such as those who might have underlying medical conditions, if they absolutely had to travel, maybe take that into consideration as well as they start doing seat assignments. I can't really speak too much for how the industry can actually make that happen. But I do think also explaining to travelers quite carefully about each of those procedures that they have put in place to try and make their travel journey safer. But I think, as representing public health advice, we really feel it is important to avoid the close physical contact as much as possible. And if not, wear the medical mask. And hand hygiene is actually really important in this context as well.
Yeah, it's Dr. Maybe just add to that. I think what your question is getting at is really the issue of both risk management and risk tolerance, and the fact is that you can do it at the population level, but it's also an individual choice, When you leave your house in the morning, you're assuming all sorts of risks. You never know. You might get hit by a bus or, who knows what might happen. So in this context, certainly what Dr. Tam and I have outlined is that from a public health perspective, the physical distancing is certainly one of the key public health measures. And then we've also talked about the face masks. That's something that can be also used if it's impossible or difficult to maintain that 2-meter distance. I would say that certainly for individuals who probably are at higher risk of, let's say, more severe consequences. If, let's say, you're a senior or you have underlying medical conditions, I think you need to, in a sense, make your own sort of risk assessment in terms of what's the risk benefit in terms of you were to go traveling, and this was, quote, maybe the only mode of transportation you could be using, taking a flight. Other than that, I think all of the other measures the airline industry has put into place, I think, the temperature checks, the mandating of the masks and so on are fine. I can't really get into too many of the other thinking and details in terms of the middle seat. If really that's the way it's going, Dr. Tam and I are quite clear that the physical distancing is probably, I think, our recommendation. But if, for example, let's say there were two people that were to sit close together, then I would think that maybe one thing to think about, or maybe who knows, that's part of the planning, is that if there were, let's say, a family or a couple going together, then maybe if they're already in their own bubble and they were flying together, then of course if someone had the the window seat and then the middle seat and so on, then that might be something that might be quite an acceptable risk for those people already in that bubble.